Scientists are working around the clock to restrain surging cases of medical tourism in the country by strengthening capacity building of local healthcare system. The alarming cases of medical transits in the country have partly been attributed to rundown laboratories which produce false diagnosis and limited exposure by the local medical experts.
The same way people are leaving Uganda and going places, believe me, there are people leaving other places and coming to Uganda. For the same reason, medical tourism.
A number of Ugandans, regardless of social status, consider treatment from abroad as the only life-saving alternative due to disappointments in the local healthcare system or referral from the experts. This has been partly attributed to rundown laboratories that produce false diagnosis and limited exposure by the local medical experts.
We need to expose our clinical teams to a lot more of some of this experience. We need to have a budget line that allows for our clinical team to be able to have proper exchange visits with some of these places where we are doing our medical tourism too. So that we don't have our doctors leaving the country and not returning, but we have our doctors eagerly wanting to come back.
Scientists have now embarked on strengthening capacity building of the local healthcare personnel to curtail the high number of medical transits.
When we look at the laboratories that we have actually assisted through the Ministry of Health, implement very strong quality management systems, gotten accreditation to the ISO 15189. When we look at those, we can also see that the levels of referrals to these facilities has increased. What does that mean? It simply means that the rest of the peripheral laboratories and hospitals recognize that there's a quality standard there, which means the element of misdiagnosis tremendously reduces.
In a related development, a global healthcare public foundation has unveiled a new logo that will see lives of vulnerable people in the country improved.
So we are glad as we take this new phase. There are so many small things that we want to work on. It's just not strengthening the health and improving the quality of life for everybody. And improving the quality of life is really, really very small things. It's from something as small as good medical results to proper nutrition to proper well-being. If you remember, SDG 3 is about good health and well-being.
It should be noted that a global healthcare public foundation has had a presence in over 15 countries on 3 continents in the last 17 years and is globally recognized as a leader in laboratory system strengthening.